salary that is effective 5 years after the effectivity of the magpakarta of health records.
So, ganito nga pala, wala ko. Pag gawin
sa quality salary po, meron tayong tinatawag na standardization. Standard po ang salary natin, maging kayo nasa syudad, maging kayo nasa probinsya, pare-pareho. Kung ang grading nyo, ba, grade 18, kahit nasa syudad, kahit nasa probinsya, pare-pareho ang ating salary. Now, the other one is public workers have completed the postgraduate studies. Hindi rin po natin masyadong may bigayan dahil din po sa kakulangan ng mundo. Yung po may mga masters, mga diplomate, mga doctorate. Meron po kayo mga katanungan siguro po kayo sa meron po kayo mga program. So, yun lang po ang mahihanda.
She would be supporting the senior for the council ito.
Dahil gumagawin niya.
Okay, let's start with the introduction. Even the designation as chief of clinics, I was at a loss. Wala akong job description. So, after a month of searching, finally, nabigyan din ako. I started by looking over our organizational chart, then other references, and it was in a nursing manual where when I saw that as a medical center, we need to have a training officer. So, I designated Dr. William D. I don't regret having designated him as chairman, so as with his members, and the rest will be history. So, this is a major step. What we're doing now is a major step, this activity, in making our MSO as an organization in which every member should be proud of. Let's start by having our policies in the emergency room.
This will be given by Dr. Roland, the head of the emergency section, emergency room section.
Just now to see with the guidelines and policies of the emergency room. Just like with other departments, we have the vision and the mission of the emergency room. Our vision is to provide effective, efficient, and immediate healthcare services for the intervention of the client's needs and problems through patient-centered approach. For the mission, to be morally responsible and professional sensitive to meet the needs of the client, regardless of the creed of the religious beliefs, color, nationality, and financial status. As you can see, this is our organizational chart. We are under the governor, the office of the governor, and followed by the provincial health officers, and eventually we are directly under the chief of clinics. Next slide. Our general objective for the emergency room personnel to be able to respond appropriately and function effectively in a variety of emergencies by putting emphasis on the assessment and immediate management of the problem that are frequently encountered in the emergency cases setting, which would yield to alleviate the suffering, discomfort, thus resulting to promotion of health and welfare of the patients. We have also specific objectives like make and report quick, accurate assessment of people in the emergency situation, prioritize emergency assessment and intervention quickly, logically, and safely. Act quickly, safely, and appropriately in emergency situation. Perform appropriately medical and nursing intervention to alleviate the physical and psychological stress on people in emergency situation. Who are governed by these policies? Of course, the physician at the ER who goes on 24 hours duty. Their duty shall attend to patient regardless of whether the case belongs to his department or not. Because of the shortage of our resident physicians, anybody who are on duty at the emergency room will attend to the case. For example, if the surgeon is operating at the OR, a pediatrician can attend to the case. This was formulated during our one committee meeting. I don't know if Dr. Maanyo just remember this policy. So for the patients 15 years old and above shall be seen by medicine, and 15 years old and below shall be attended by a pediatrician. This is based on the Memorandum Order number 13, dated March 13, 2001. Health personnel who are on duty in the ancillary department, for example, pharmacy, X-ray, and laboratory, whose services are needed during emergency situation, must endorse to the nurse on duty at their whereabouts. All medical and nursing personnel who are on 24 hours duty at the ER are required to wear the prescribed uniform, blazers for the resident physicians, including their IDs in order to identify properly for professional reasons. Patients whose sole consultation and other services at the ER is not admitted are required to pay the services as follows. Consultation for 20 pesos, suturing of 50 pesos, injection 10 pesos, nebulization 20 pesos, catheterization 20 pesos. These are just donations. Admission of patients must be done at the ER only for proper recording and monitoring purposes. The communication system must be used in calling the resident on duty starting from 6 o'clock to 9 p.m. only except on emergency situations. Monthly schedule of all health personnel who are doing their duties, services at the ER must be submitted to the head nurse on duty. I think this is already done and still being followed. Monthly monitoring of and inventory of all emergency drugs and medicines should be done by the head nurse assigned at the ER. No casting will be done at the ER except for patients whose fracture is in good condition. No dressing of wound and removal of sutures will be done at the ER. Check-up and follow-up of patients should be directed to the OPD. Functions of the emergency department. It is the basic duty of the emergency department to render care to the sick and the injured without consideration of or monetary remuneration, regardless of the creed, nationality, and social status. The ER should afford the patients with the best possible care, with the least delay, and with the greatest personal consideration and simplicity.